Hey everyone, Eric Cox here with Netcapital, and I'm very grateful to have the team of Feel Good Labs on the line with me today. Let's allow 1 or 2 moments for people to get situated and we'll dive right in. Thanks. All righty, everyone. Well, thank you so much for everybody attending. Thanks to the attendees. Also, thanks to my panelists, Ryan and Kyle, members of the Feel Good Labs family. Before we get started, a couple of quick housekeeping items. As always, this is being recorded. And as always, I'd love to keep this as interactive as possible. So please do use that Q&A functionality that is built into Zoom. I already see a good morning. Good morning, Martha. Feel free to please use the Q&A functionality so we can keep this as interactive as possible. There is also chat function, but Q&A makes it a lot easier to keep track of the questions and makes sure that we can get to as many of them as possible. Also, and I'm overusing as always, but I'm just going to keep the party going here. As always, Feel Good Labs is actively fundraising on the Netcapital platform. I just added a direct link in the chat. Please do not hesitate to visit netcapital.com and search Feel Good Lab, or go directly to netcapital.com/companies/the Feel Good Lab, and you can directly invest. You can also learn a little bit more. There's also some question and answer functionality there as well. With no further ado, Ryan, Kyle, why don't you hop on in and tell us a little bit about the Feel Good Lab?
Cool, thanks, Eric, and thanks Netcapital for having us on. So, from a high level, what we do at the Feel Good Lab is we make healthier OTC medicines for sufferers of chronic pain that are made with plant-based ingredients. And the big thing for us is that they're effective and safe. Big emphasis on both those words, because what we find, obviously chronic pain is such a debilitating condition, and efficacy is at the utmost importance to sufferers. But most of the solutions out there today are ineffective when they're taken every day. In fact, many of them cause side effects. So we find that our customer base of chronic pain sufferers do not have healthy options available to them over the counter today.
Thank you so much for the background on that. And then if we can dive into the team that is running the ship here before we go into the problem and solution and everything. So Ryan, why don't you kick us off? Why don't you tell us a little bit about yourself, and then Kyle, if you could share about yourself and the rest of the team members that aren't on the line.
Sure. So I'm Ryan Gresh. I'm the CEO and one of the co-founders here at the Feel Good Lab. And my background personally is actually, I'm an aerospace engineer by training. I spent almost a decade in the aerospace industry before following my passion into this. And you might question, how do you go from aerospace engineering into health and wellness and over-the-counter pain relief? Well, my father is a compounding pharmacist, but before that, my grandfather was a local pharmacist. 4 of my aunts and uncles are pharmacists. My brother is a pharmacist. It is my family business. And so really the genesis of the Feel Good Lab starts with my dad. He's the lead pharmacist here at the Feel Good Lab, and his specialty became treating chronic pain, specifically treating it through the skin. So one of the things that he learned early on, and this is kind of a little bit about the problem solution, but I think it's really important to understand the team. When we're over here making over-the-counter medicines that have FDA registration and claims, the scientific backing is so important, and the credibility of where our products come from. So, my dad started out his career as a conventional pharmacist, and we owned a pharmacy in our local community. I would go in and work with him. And throughout the 90s, we saw firsthand the catastrophe that the opioid epidemic was causing. It wasn't just chronic pain, but almost any chronic condition that my dad was treating with the traditional pharmaceutical model, which is, you get prescribed a pill, usually they mask symptoms, and they don't really address the underlying root cause. We saw firsthand throughout the 90s, our local community just get hit really hard. People coming in month after month to fill prescriptions, getting sicker. And so we decided there had to be a better way. And he sold the pharmacy to CVS in 99. And we opened up the nation's first combined functional medicine practice with compounding pharmacy. What this allowed us to do was two things. One, on the functional medicine side, it's much more about working with individual patients to find out what that root cause is. So in chronic pain, there's always a cause. And if we only look at masking the pain and the symptoms, and we do nothing to address the underlying root cause, we're not going to get any results. The other big piece of this, which is equally important to how the Feel Good Lab got started, is he kept open his pharmacy. And he had the ability to compound customized medicine for people with chronic pain. So it could be customized dosage, customized delivery method. And throughout the early 2000s, he became an expert. Really, that was when people didn't understand that we could deliver medicines through the skin. The skin was thought of as more of a barrier. Today, we know transdermal medicine is one of the fastest growing segments that there is in medicine. But back then, it was an untapped territory. And he became a leader in developing customized pharmaceuticals to deliver some of the same potent medicines that people would take orally. An example would be something like ketoprofen, which is a very powerful NSAID, but when you take it orally, it causes severe GI distress. When you could deliver that same ingredient through the skin right to the source of pain, it would reduce inflammation, give you the pain relieving properties you want with zero GI side effects. And this is game changing because a big part of treating chronic conditions is the balance of efficacy versus safety and side effects. And when you take a prescription or you need to take something every single day, that's when the side effects really stack up. So to kind of fast forward quick, the genesis of the Feel Good Lab came out of my dad's pharmacy and all of the work he was doing with individual patients, because basically in the early 2000s, they became coming in and say, Gene, this is amazing, but I need a prescription to work with you. What would you recommend over the counter? And as we looked at the products over the counter, the brands that were developed decades ago, they were not the right topical transdermal solutions to treating chronic pain. And so we decided to take his expertise and launch our first product, which is our natural pain cream. And it's based on the core formula that he was using in his pharmacy. And then it took us many years to kind of get the development right, where we could find a manufacturer and we could get a patent and FDA registration and whatnot. But my dad is really the basis and the genesis for everything we do here at the Feel Good Lab, even when it comes to future products. We love it because it allows us to really have that direct connection with the customer. We're dealing with patients every day that have these chronic conditions. And then we can try things to see what's working. We can be on that leading edge and actually working with the patients, roll out some of our prototypes in that area, and then find out actually what's working to decide what we're going to bring to the market through the Feel Good Lab. So outside of me and my father, we have an amazing team. We have another co-founder, CJ Force, who leads our branding and marketing. And CJ's background, in fact, he was actually an engineer in undergrad with me at Yukon. We're good buddies going back. But as soon as he graduated, he didn't wait a decade like I did. He went out to California and joined a marketing agency where he became the youngest VP at the agency. He was running their strategy. It was an omnicom agency. And he just brings a lot of great tools that we need when it comes to building a brand in the 21st century. And then from there, our third co-founder is Kyle Fitzpatrick, who I'm going to kick it over to tell you about himself.
Take a breather, Rye. All right. So thankfully for everybody involved here, one thing I just want to underscore is that the team that's on this call, we're essentially the commercialization team. And the way that we look at our team is we have the scientific credibility and the formulation side of things, which Ryan kind of goes back and forth on with his connection with his father and Gene and how we formulate our products and do our R&D. And then we have the commercialization side, which is essentially where I fit in as the COO. And when it comes to commercialization, we look at route to market and how can we, the question we need to answer is how can we put ourselves in front of our potential consumers? What are our strategies to go and do that? And before we go off on that tangent on what our route to market is and what the partnerships are, so my background, I come from a consumer goods background. So I was with Red Bull for about 5 years. That's where I got my sales, marketing, and distribution chops. And I ran a lot of different roles while I was at Red Bull, mostly focused on the distribution aspect. And what's interesting is that while the product of an energy drink is so much different than an over-the-counter pain reliever, they share a lot of similarities in the distribution channels and the marketing strategy. So it's been quite nice to dive into this project. So that's my background, through and through. CPG is my history, and I head up our commercialization strategy when it comes to our route to market. Beyond myself, we recently, probably about 8 or 10 months ago, we brought on a managing director who's amazing. Her name is Lynn Clark, and she brings a ton of experience in CPG as well. She sits on a number of boards. Coca-Cola, one of the Coca-Cola distributors is one of them. Nielsen Massey, vanilla flavoring company is another. And she helps us with strategic planning and really the big picture management of what are the important priorities of the business. And you'll notice that Ryan and I like to talk a lot. So she shuts us up and gets us focused on the core things that really matter to the business. And when you peel it back, there's really only a few things that really we need to focus on to drive success. Outside of Lynn, we have Sam Markle, who came from Zimmer Biomet. He was also a former professional basketball player, and he helps on the brand partnership side as well as the sales side and the development of our healthcare channel with his connection to Zimmer. And the last one I want to mention, it goes back to the scientific side of things and the formulation side, and that's our partnership with Yukon Health. So we are currently in the Yukon Technology Incubation Program, which is a really amazing incubator for top pharmaceutical medical companies around the country. And the University of Connecticut recruits these companies into one lab center in Farmington, Connecticut, where companies can work together, take advantage of resources, and really build for the future on game-changing technology. So we were accepted into that about 1.5 years ago. So we've been operating with Yukon at our side, which has been really great on the R&D and the work that we need to do to launch our next suite of products. So that I'll close it at that. So it's commercialization and it's science and credibility, and that's the way that we see our organization.
Perfect. And I do see those questions coming in the Q&A. Thank you so much for our attendees, and please continue to send them. Before we get too deep into the specifics through those questions, though, I'd love to ask a couple more general questions, so do hold tight with me. Can you tell me a little bit more about your advisory team? I see a star-studded cast here, and also I recognize that we have a strong Yukon connection here. We have a Yukon member of our team as well, so go Huskies. I'm gonna put that out there. But please tell us a little bit about Mark and Nikki and some of the rest of those team members.
Yeah, so on the advisor side, Mark Bartolami has been a great help to us. It's been about 3 years now since we've been working with Mark. And his background, he was the president and CMO of Duracell batteries. So when it comes to getting recognition in the store, think about the battery sets and how they're in literally 7 different places across the store, and driving that trial and awareness. He's absolutely amazing. He also brings the perspective of being the president of the whole organization. So helping us to kind of put together the pieces that we're going to be able to scale as we grow and become a large organization ourselves. Nikki is another incredible partner. Nikki brings a really unique background because she was one of the first employees at Alex and Ani. They grew to, I want to say, over 100 million, but I don't have the exact number, but more, yeah. And she was a huge part of that. The other unique thing about Nikki is that over the past few months, she's gone viral on social media herself with over 1 million followers on different channels. And so she kind of bridges the gap of the social good and the way to leverage social media. She has a business called Social for Good. And so she works with us on making sure that the things that we do are also supporting our customer base, supporting the people in chronic pain that we're really here to help. And then lastly is Ben Bergeron. So Ben is, if anybody on the call is familiar with CrossFit, you probably know Ben. Ben is one of the most famous people in the CrossFit world. He trains many of the top athletes. Katrin David's daughter, who's a 2-time CrossFit world champion, trains with Ben daily, as well as many other top 10 on the women and men's side. And so what Ben gives us is, one, access to his network, but it's a ton of credibility with Ben. When somebody of his stature, the reason Ben started working with us is because he actually had a personal experience with our product where he wasn't able to run. He got introduced to our product from somebody that went to his gym. He began using it as directed. And after a week, it was for the first time in years, he had the ability to get out and run because of heel spurs. So his personal experience, he ended up getting in touch with us and we started this amazing partnership. But there's a lot of untapped potential there. And as we scale and start to build our credibility in the athlete realm, Ben's going to be a big part of that.
Awesome. Thank you. I love asking about the advisory team because I think the core is super important. The team is everything, but then the expanded roles to advisory, I think, are really important in getting to the next level. Can we go back to 30,000 feet again for a moment? Let's talk about what is the problem? What are the specifics around it? What is the data telling you? And then how does Feel Good Labs fit into the solution? And then we'll start opening up the Q&A from the attendees.
Yeah. So the big epidemic that we're solving is chronic pain. There's 100 million Americans that deal with this every single year. And the sadder statistic, I mean, that's a third of our country, which is unbelievable. But the sadder statistic is that 2/3 of them wake up every day believing that there is no solution. They almost lack hope. And the reason is most of the solutions out there, opioids are an incredible tool for the job, but that's when it comes to treating acute pain. Because if your pain is chronic, which means there's an underlying root cause, it hasn't gone away in 6 months, and you treat it with something like an opioid, you're only masking symptoms. So we look down the line at the other over-the-counter remedies, and the number one used to be the number one. The topical trend is definitely growing, but you look at oral NSAIDs. The same sort of side effects exist when you take oral NSAIDs every single day. We've surveyed over 2,000 of our customers, and more than half of them take an NSAID every single day. So these are scary statistics when you think about the side effects that come with that and the GI distress. From there, the CDC now recommends for chronic pain that topical is the frontline defense because of those nasty side effects. But when we look at the brands, if you go down the aisle at CVS, the brands that you'll see there are the same brands you saw decades ago, and the formulations really haven't changed. They include ingredients that we would definitely not ingest. And when we start to understand that our products are designed to deliver them through the skin to the site we want, actually to penetrate the skin, they're not much different. And so we think it's very important to pay attention to the ingredients that we use, not just the helpful ingredients like turmeric and arnica and aloe vera that can help the delivery, but also removing the junk. There's a lot of preservatives, color additives, fragrances that are just simply not good for you. And so we just think it's very important that we have a healthy product if we want to do anything to affect the chronic pain epidemic.
Absolutely.
One piece that I want to add there that's very important is, and we always lead with this, efficacy. It's one of my favorite quotes. A sick person wants one thing and a healthy person wants 10,000 things. When you are sick, you need it to go away. And when it's chronic pain, that's no different. So efficacy is number one on our list of things that we try to do for our customers. Safety is next. And, people want safer, healthier options, specifically natural ones. There's a massive trend going on. Our big breakthrough for the Feel Good Lab and really where our distribution got legs is last year, there was a Mintel report that came out. So, Mintel's an agency that'll do market research and survey thousands of customers and then sell the report for $10,000 to the buyers at CVS and Target to make their decisions on the category. And there's a whole, always the report talks about the topical segment is the fastest growing segment in all of OTC pain relief because people want to take less pills and they know that topicals have less side effects. But, usually that's kind of where it ends because there's not a lot of brands that are coming in and making a wave here. They had a whole section of the report on natural. And so they surveyed 2,000 customers that had bought a pain reliever in the aisle in the past 12 months. And 84% said they wanted to try or had tried a natural pain cream. This was huge for us. So we started taking this data everywhere. When we dug into the back end of the data, we found that Mintel actually surveyed customers and showed them our product and brand. So we immediately took this and we had connections that we were working through in different retails. But when we sent that data to them and the buyers at different retail partners saw that there is no healthy option in their OTC aisle right now, yet 84% of consumers are willing to try it, they knew that they had a huge untapped potential. Because it's one thing if we're, just stealing market share from one of the people in there already. And we hope to do that. But we believe that the biggest advantage we can bring to the retailers is a whole new demographic of customers that wouldn't normally shop the OTC pain aisle because they're looking for healthier, more natural solutions. And so that's where our brand fits in. We need to make sure that we get the scientific credibility to perform on the efficacy side and to be able to make the claims around that. But our safety and the fact that we're natural and use plant-based ingredients is very important to consumers still.
Absolutely. And for those who are unfamiliar, Ryan, you mentioned NSAIDs, and you're talking about the general pain relievers, the ibuprofens, the naproxen sodiums, and I won't name any specific brands, but I think everybody gets the general idea off of those two. Okay, awesome. Just to make sure everybody's following along at home.
Exactly. Yep.
Perfect. And then let's dive into your solution. You showed us a little bit of the product, and there are some specific questions that I really want to get to. So if you could give us back to 30,000 feet, what is the Feel Good Lab solution, or what are they in terms of a product line?
Sure. So today we have two products, but they're based on the same core formula that came out of my father's pharmacy. And our products today are formulated with natural plant-based ingredients. But at the same time, one of those plant-based ingredients is actually an FDA-approved drug, and that's menthol. So just like the other competitors I talk about in the aisle, and I won't name the brand names, but for the most part, every single one of them is going to have one or two active ingredients. That's either capsaicin, menthol, and what they do is they cause a sensation on the skin. It's called the gate theory of pain relief. So I see a question in here about FDA. We are FDA registered, so we're not approved. We don't approve as a new drug, but we get registered based on the current ingredients that we have. The FDA looks at, do we have any ingredients that are already approved for efficacy? And we do, with menthol at the minimum effective dose of 1.25%. And then they look at our other ingredients and make sure that they're safe. From that, they allow us to make claims around arthritis pain, back pain, muscle and joint pain, etc. But really for us, the special thing about our product is not the menthol. You know, menthol is great and it takes the edge off, but that does nothing to address the underlying root cause. At the same time, we need to be really careful because we are a drug. We are an over-the-counter drug. We're registered with the FDA. In fact, we just got FHA and FSA eligibility just this week. So the things that we can say and can't say are very clear, and they've been clear for decades. We look to our competitors to really look at the benchmark for making claims in our category. At the same time, we know that our product is different because it works different. We have ingredients in there that we actually want to get delivered to the body through the skin. Things like turmeric, which is an anti-inflammatory. Arnica has been used topically for centuries in Eastern and Western medicine to help with bruising and inflammation, and many other ingredients. And so the formulation really came from not just the core formula my dad had, but when we looked to bring this to market, we actually worked with an incredible herbalist named Becky Montrone out of New Hampshire. And she came to the table with herbs that she had been using in her apothecary to treat some of these conditions for, again, decades. So she had the real experience. And what we did, we didn't just launch the product and build a brand and start selling it. We actually tested it for 2 years on hundreds of patients in our pharmacy before we went forward to find a contract manufacturer to go produce it, get the FDA registration and whatnot.
Thanks, Ryan, for directing us directly into the Q&A here. So that was the FDA question. Thanks for asking that. Is your product addictive? Let's talk about addictive nature of these products. Ryan or Kyle, you want to field that?
Yeah, our product is not addictive. It's one of the reasons that that it's now recommended by the CDC that topical is the frontline defense, because we know that opioids, as an example, are very addictive. And you get trapped in the loop of needing to take them to satisfy the pain, but really not addressing the root cause. Our hope is that we're the only pain relief brand that actually allows customers to not need us anymore. And it might not sound like it's not the best business case, but it really is, because if we can help 100 million Americans, if we can just help them with their chronic pain, let alone get rid of the need for a pain reliever, we can make a massive impact. But topical products, especially ones with menthol and the way that we work, are not addictive.
Perfect. Thank you so much for that. And continuing along the line here from Jesse, what do your sales look like, units over the past 12 months, and any forward-looking sales projections? And I think we might want to avoid projections on this call from a regulatory standpoint. So can we talk about past sales and traction?
Sure. Kai, you want to take that one?
Yeah, I'll take that one. So what is it? It's almost Christmas now. So yeah, our 2020 numbers are basically in, and we're going to come in around $250,000, maybe slightly below that. So 240 to 250, depending how the last few days go. And if you break that number down and you look at what channels are driving that revenue, Amazon is number one. That's done the majority of our volume this year. And then after that, it comes down to CVS and also Target, which we're running pilots with currently. So we're in about 350 stores, maybe a little bit less than that, across the United States with CVS and Target. And that's a big milestone that we're working on now into next year, is continuing to build that relationship with those retailers and others that are like them, so that we can expand distribution and get our product out to everybody who needs it. So we have to be careful with, saying things about what revenue we expect in 2021 and 2022. But one thing that is a good case study that we look at is one of our competitors. They're called BioFreeze. I'm sure a lot of people are familiar with BioFreeze. So BioFreeze's route to market is something that we are following to a T. They built their credibility in the healthcare practitioner space. So they worked with chiropractors, physical therapists, massage therapists, and podiatrists to build their brand and build their product following. And then they launched in brick and mortar retail around 2014, 2015. And in their first year in brick and mortar, they did $7 million, all through really one partnership with Walmart. The next year, they did 29 million. The next year, they did 92 million. So they went from 7 million to 92 million, really on the strength of that one retail partnership, which they were able to expand nationally and have multiple distribution points throughout the store. So that's exactly what our aim is for next year. We have an opportunity out there today where we're looking to launch with I won't say who they are, but one of the top healthcare distributors in the country that works with 30,000 chiropractors and physical therapists, podiatrists, all of that. So we're working on a partnership with them to get our products out there to that market of chiros, which we do sell to today. It's a small part of our business, but we know that those customers really can use our product and are looking for the things that we're bringing to the table. So we have a potential to launch with them in the summer. Or towards the fall. And then if we can continue the relationships with CVS and Target, just an expansion with CVS, say to 2,000 stores, it could be over $1 million in the purchase order right there. It depends on what products they decide to purchase and what the in-store presence looks like. But it's very realistic to look at the store count and their average order value and put a number against it. So to not put any specific numbers down, I just want to make clear what the strategy is, and it's to expand distribution in that healthcare channel, which builds our credibility, also builds our awareness, because where do people go when they're in pain? They go to see a trusted healthcare provider. So if we can get that healthcare provider to start using our products and explaining our products and getting them out to the world, that's where we can make the biggest impact. And then you follow suit on the rest of the channels of distribution through brick and mortar, and that's the game plan.
Absolutely. Congratulations on that traction so far, team.
Thanks.
I know we discussed, during the kind of solution part, you discussed some of the ingredients, but I think it's important enough. It was a specific question, and it might be worth going back for a moment. Can we talk about what are some of the specific natural ingredients in the products in Feel Good Lab?
Sure. So we have 30 ingredients, and I can rattle off a handful of them, and I can shed a little bit of light on why we put them in. Something that's very important is, again, with the FDA, we are an over-the-counter drug because we have menthol. So we can't go out there and market that turmeric is an anti-inflammatory or that aloe vera helps things absorb through the skin, but we know that. And so keep in mind, there's got to be a little bit of a difference by how we show to the consumer. And the way we do that is on our product packaging. We make it very clear of all the ingredients that we have. We even show images of them on the side of the packaging, and consumers love that. So I'll just rattle off, our top 10 here. Arnica, turmeric, chondroitin, glucosamine, menthol, beeswax, aloe vera, devil's claw, annatto seed, yarrow extract, boswellia, calendula, vitamin E, magnesium, skullcap, and MSM. And MSM is a sulfur-based compound that's used to really, really enhance the penetration of the skin. It's one of our favorites. My dad he learned about it in the early 2000s. And by adding MSM to their pharmaceutical formulations, they could deliver a lot more of the active ingredients that they want to the site.
I love the transparency there. Thanks for sharing. That question was thoroughly answered. Perfect. And then this one's a longer one, and I haven't seen it exactly yet, but let's just go for it here. Have you tested the efficacy of your product over time? And then I think let's just start there. Have you tested the efficacy of your product over time?
Sure. Yeah, we have some anecdotal studies that we've done, with surveys through the patients that we work with at the pharmacy, and then as well with the CBD product that we have in development. We've also got some tests coming back. In, again, anecdotal test results. So we don't have the clinical studies yet. One of the nice things about where we sit as an FDA registered OTC drug today is we can make claims around arthritis pain and back pain and muscle and joint pain without spending the multi-millions of dollars that it often takes to do a double-blind placebo study. At the same time, we completely plan to, because to really make a dent, that credibility, we can't just rely on our marketing, branding, our distribution, and our partners. We want to be able to say that we work better than XYZ on the shelf and really compete that way. So through our partnership with Yukon, we're actually working right now with their grant division to work on getting some funds to help support the study because they're so expensive. We're looking to leverage the partnership with University of Connecticut, who in fact, one of the beautiful things is they've already done a placebo double-blind topical study with a product that includes some of the ingredients in here. Now it's not even close to the same product, but they've been able to complete the exact study and prove that it was better than oral NSAIDs. So we believe that Yukon's the right partner for this. It just depends on the timing and the funding to get it done. On the other side of that question, we also do a lot of safety testing. So every single batch gets run through a test that looks at the microorganisms in there, the ingredients, making sure we have what we say, as well as doing a stability test to make sure that the product stays stable through our entire shelf life, which today we market as 2 years. We have the ability right now to potentially go to 3 years. There's some pluses and minuses to that. And so we may enhance the shelf life to 3 years, but right now we're approved for 2 years.
That's fantastic. And this next question actually goes to a broader question. So the question itself is, what is the difference between your product and medical marijuana? But I'd love if you could take even a broader approach and say, what is the competitive advantage to other players in the space as well? So other topicals as well as medical marijuana and NSAIDs. You discussed I think the value proposition over NSAIDs, but with medical marijuana and other topical creams, where do you think you fit in from a competitive advantage standpoint?
Yep. So on the competitive side, if we just look at the topical OTC aisle, the two competitive advantages that we believe we have is one, we're made with clean, natural ingredients. So, if you even just said we're the same because we have menthol and you don't believe in any of the natural ingredients we have could have any efficacy, we believe that we're better because we're safer and we have better, more healthy ingredients. On the other side of that, we think that those other ingredients are a huge differentiator. And that's why we're willing to put our money where our mouth is with the double-blind studies. We've seen with the anecdotal evidence that people get significant results. If you read some of the couple of hundred reviews that we have on Amazon that are real customers, we get feedback sometimes that I don't even believe, right? There's an aspect of whether you want to use the placebo or whatnot, people with debilitating conditions that are completely healed after using our product. Now, we fall somewhere in between when it comes to efficacy. No over-the-counter product is going to be able to absolutely heal the chronic pain epidemic, specifically for everybody. One of the big breakthroughs, though, that we believe is going to be game-changing is medical marijuana. Now, marijuana is going to come down the pipeline, with the regulations federally, but today we have CBD that's approved to based on the 2018 Farm Bill to be sold in products like ours. And so our CBD prototype, we're already getting better results. This is anecdotal again, but a couple people that did not give us positive feedback on our natural pain cream were the first people that I got our CBD cream in the hands of. And every single one of them is knocking down my door to get more, even though we don't have it. So that's kind of one of the anecdotal signs that the product's working. But on the other side, when we look at the CBD space and the science that's coming out in the treatment of chronic pain using cannabinoids like CBD, THC, medical marijuana, it's a very untapped territory. So we need to be a little careful because we want to be the credible source bringing education to light. One of the things that we pride ourselves in, we are not a medical marijuana company. We are not a CBD company. We are a pain relief company specifically built on the tenets of functional medicine to do it in a healthy way. And medical marijuana and CBD will fall into our product pipeline the way that they do, but we're never going to lose sight of the real job at hand here, which is helping people find solutions to chronic pain in a healthy way.
Yeah, just to underscore that, I think it's really important to make this point. While we will launch a CBD line of products. We are a pain relief brand, and CBD is a tool that we will use. But if you look across the spectrum of companies that are operating in the topical CBD space now, there is a whole lot of shadiness and products that don't contain what they actually say on the label. But when you do the analysis, it's incorrect. And nobody is really bridging the gap of having the FDA registration and having products that have CBD and don't have CBD. And that's our angle, is we can cater to both sides because we are a pain relief brand. We're not a CBD brand.
I think it's a really important distinction to be made. So thank you for that. Excuse me. We're a little more than halfway through our program, scheduled programming here. So I'd like to remind people that, as always, the Feel Good Lab is actively raising capital on the Netcapital platform. You can go directly to the link that I added into chat, or you can go to netcapital.com and search the Feel Good Lab. Shameless plug there. There are a couple of questions I think we can tie together, and we might be able to manage the inbound a little bit more effectively. So if you'll follow my little string of analysis, I think we can get this done here. So how do you envision making money for yourself and your investors over the next 1, 3, 5 years? What is the long-term goal for exit and potential timeline? And are you open to getting your product or company acquired? You think we can handle all three of those in one shot?
Sure. Kai, you want to take that one? Or you want me
Yeah, I'll take it all. Easy answer. No, let me start with the first one. I think it was, how do you envision making money in 1 to 3 to 5 years? So with our strategy, it's a retail distribution strategy where next year in particular, there's a heavy focus on the healthcare channel. So that's going to be led by the chiropractors. Hopefully, if we see spas start to open up, massage therapy as well. I see somebody asking a question about fitness and gyms and all of that. So the distributor that we're working on a deal with has an arm for that specifically. The challenge is with COVID and what's going on in the world of gyms right now. It doesn't make a whole lot of sense to push out something new there yet. But to put it simply, that is our focus: expand distribution, and that will be the main driver of our business model. We expect that with the expansion of distribution in the healthcare channel with CVS, with Target, and there's other retailers, there's other drugstores, there's other grocery stores, there's other mass merchandisers. We think we can get to all of them eventually. And the strategy of focusing on this distribution will get us more awareness in the consumer's eyes and will lead to a rise in our e-commerce as well. So that's essentially the longer term and the short term strategy. Is this retail distribution strategy is going to take a few years, because we know how long it takes to build a relationship with a retailer. We were talking to CVS a year before our products were on their shelves. So, and then there's a testing phase, and then there's analysis, and there's review. So it takes a couple of years to really build that traction, and we've built a lot of it. So now we have to go and execute and capture that market, and that's how we'll make money.
Kai, can I add one little point there? It's really important. People might think we're crazy right now in the middle of COVID to say our strategy is retail. And obviously there's a digital component to that, but people need to keep in mind that in our category, over-the-counter pain is still, even with COVID, it's predominantly bought in the store. It's for many reasons. One is the credibility that comes with buying it in a pharmacy. 2 is you want it now, and these products are sold at the corner of everywhere you can imagine: gas stations, pharmacies, grocery stores, etc. So it's really about where the consumer wants to go. And we've seen the consumer trend, obviously a little bit more digital, even in our category. But when we compare our category to other categories, it is an absolute fraction. So our focus, our eye is on the prize, and we don't believe COVID is going to be here forever. We know that retail distribution gives us 3 things. It gives us sales, it gives us awareness, and it also gives us credibility. And those are really important to us.
Absolutely. And if we can add in a little bit about the exit strategy on that as well, just big picture, are we thinking IPO, M&A? What do you think fits the best for Feel Good Lab at this early standpoint? No one's holding you to it.
There's a lot of acquisition potential, and we're certainly open to being acquired. We're also open to building the leading brand in the OTC pain space. So, we believe that we have the team and the opportunities in front of us for the next 2 to 5 years, between the retail expansion, the product line expansion, and the and really the content we can develop to help people. There's other ways we can help people recover from pain in a healthy way. There's a lot of wellness education that comes into this as well. And through those three main tactics, we think that we've got the team to do it. So really for us, we want to change the world and build the best company we can. When the time is right for us to hand the keys off, we're absolutely open to that. But there's so much opportunity on the table right now that we want to get our hands dirty.
Absolutely. Absolutely. Another combo here, who does the manufacturing, and are the ingredients coming from / made in the United States?
Sure. I do not want to disclose the exact manufacturer, just in case, competitors or whatnot are calling, but we have an incredible partner. They're in the United States and in the southeastern portion of the US. And one of the neat things about them is they are the US's leading sunscreen manufacturer. What that means is they do millions and millions of units at a clip. So we're currently at the very small side of production with them. We did that on purpose because we wanted a partner supplier that could scale with us. The other big important thing is they have to be FDA registered. So their facility goes through audits. They do a lot of the stability testing, the third-party testing. So they bring a very important piece of credibility to what we do. And then they also work with us on sourcing the ingredients. So, by leveraging some of their other partners, there's some natural sunscreens that might share ingredients with us. We're able to buy in much more economical sizes. So some of our ingredients are sourced. In fact, most of our ingredients are sourced from the United States. Menthol, as an example, is sourced internationally, but menthol is an ingredient that we have numerous backup sources for. So we're willing to take that risk. But a big part of our supply chain this year, after COVID happened to us, is getting everything into a more local supply chain. So we've moved our plastic manufacturing from China to the United States. In that move, our partner's actually been able to use a new recycled plastic. So not only are we moving here to the US, we're really proud about that. We're now going to be able to use recycled PCR plastic in all our plastic tubes going forward.
Which means we're actually plastic negative, which is a cool angle on the sustainability front. So it's that's been a nice win for our supply chain this year.
Yeah, we're plastic negative because we donate to take plastic out of the environment, double the weight that we put into it, as well as using recycled plastic.
Wow, that's a really exciting angle. I think we could sing that from mountaintops. Very cool. A win-win there. And then let's also discuss. You discussed the manufacturer and their ability to scale. So let's do the scale question here. Are you able to quickly scale production if you receive a large purchase order? Where is the product currently produced generally?
Yeah. So it's produced, on the eastern coast of the United States. And yes, we are able to. It comes down to cash. And so, with a huge production order comes cash. And so say it's a vendor like CVS. We know what their payment terms are. And so we're going to need to produce that order ahead of time. And the cash flow is a big part of it. So really there's two sides to cash when it comes to managing our business. We're raising a portion now, and that's really important to fund our growth. But we can't lose sight of the fact that cash flow is always going to be a problem for our business. As we scale, we'll need more money to buy inventory, and it might take longer to get paid from some of these big vendors. With that, we've got some great debt instruments in place, and we're finalizing a deal with the state of Connecticut for another $100,000 long-term debt. And we want to use this long-term debt in order to fund our inventory. And that way we can focus the growth through the Netcapital and the other fundraising for equity to really fund the growth of the company and not just pay for the revolving line of inventory.
Right. I think that's important. We're not looking to raise equity dollars to finance our inventory. And when those large purchase orders start coming through, we have ways that we'll be able to finance that through debt instruments. And there's plenty of options out there. But when we get those large purchase orders, we need to invest to support where those purchase orders are going. So CVS places a large order, our healthcare provider places a large order. We need to invest that revenue back in making those channels work and building awareness so we can succeed. So that's the game is, we finance the inventory through the vehicles that fit inventory finance, which is debt. And then we raise some equity to pay for the growth.
That was really important, and that actually goes to this next question, and I'm gonna field part of it, but I want to hear your perspective on the rest of it. So, why crowdfunding, and what are you valuing the business at for your raise? I'll handle the what are you valuing the business at. Good news, you can go directly to netcapital.com. You can see all the deal terms there. You can even review the deal documents yourself. You can be an incredibly informed investor. So I do want to direct you directly to netcapital.com and search the Feel Good Lab for the valuation, total amount raised at this point, and all that good regulatory stuff. But why crowdfunding? I think that's just, not everybody asked that question. I'd love to hear your thoughts.
Yeah, the biggest one is with what we're trying to do, there's a level of transparency and proudness to what we're doing. And we've gotten to the point where, there's a lot of places that are playing Shark Tank. And a lot of times they're not our investors. They're not our people. And so we wanted a place that we could go and really get our message out there and find the people that this resonates with. The other piece is we want to be transparent about every single thing we do, whether it's CVS that clicks on this link, a customer, my grandmother. We're very proud about every piece of it. And so we thought that the crowdfunding opportunity was a way for us to kind of double dip with PR because, we believe in our story and we believe in the traction we have. And we also think, giving non-accredited investors a chance to be a part of what we're building was really important to us. Because we don't necessarily think, we know now, especially running a business, it takes money to make money. But, most of the growth comes from companies at our stage. And so we want that, obviously there's risks associated with that, of course, too. But we love the fact that crowd fundraising, gives us the ability to just be honest with our story to everybody.
It's funny, like if everybody wants to have drinks tonight and have a separate call on why crowdfunding, we could spend 2 hours on this, on how the regulations have changed over the years and what types of investors have gotten access to certain types of equity. And I'll tell you that we strongly feel the people need the opportunity to reach those levels of investment. But what has been an interesting side effect of this is that the community that we are able to now build by doing this. We have I think there's 150 investors that have put some cash in, and it's ranged from $100 to $100,000 on our Netcapital page. But we now have this mini army, this community of people that are behind us and can serve as brand advocates if we do what we say we're going to do. So that's been pretty cool to see. Is we've had so many people come from our backgrounds and history and past jobs that really we didn't think of, and now they're a part of our team, which is cool.
I couldn't have scripted that. I did not script that. So thank you so much for sharing your feedback on why you went this direction. And I hope people appreciated that kind of the level of transparency that you are providing in the space. I think that's really important. So thank you so much for asking that, Michael. And then let's talk about. There was one question earlier in the day that was talking about where you can get the product. I know you mentioned Amazon, you've mentioned CVS, but can you tell us about bigger picture where some of the other retail partners, and then how much does your product cost?
Sure, the cost is a huge one for us because this is something that we're learning an important lesson. The cost, the ability to sell online versus in store are completely different animals. And so today we sell a 3.4 ounce tube for $28 at CVS, and you can actually find it for $24.99, which is our minimum advertised price through Target. The challenge with that is our product is much larger than almost every competitor on the shelf. And so what we learned is in order for a new brand like us to succeed, we need a smaller price point to drive trial and awareness. So with both our partnerships at CVS and Target, we're launching a 1.7, which is half the size product that'll be priced under $18. And with discounts, we'll be able to get it into the $12 range. That we believe is going to be monumental for our ability to get people to try the product. Just a little anecdotal experience. We launch in CVS and I go hide in the aisle next to it, and Kai did the same. And we peek over all day the first couple of days we're in there to just see the consumer experience. And we felt like we're going to fly off the shelves. Now, meanwhile, this is in March when COVID had just happened. So we were super careful hiding there. And there was different consumer, people aren't touching things, people aren't reading. But one thing people are looking at is the price. And I heard numerous people have discussions in our aisle about price. And what we learned is that absolute price is the entry point for people to try the product, and we need to solve that. So in our production batch right now, we've already kicked it off. We're launching a 1.7 ounce size of our natural pain cream. That's going to be really important to drive trial. But we also look at, getting larger, more economical sizes, because we have people that are buying a 4-pack every month, maybe for their whole family. But there's ways that we can kind of solve it from both ends. So having smaller sizes to drive trial, and then larger sizes that make more sense financially.
And I think the question too was, there was something about like where they will be found. And just to put it simply, our focus channels are healthcare, which is the chiros, the PTs, podiatrists, drug, CVS, and the other drug stores, mass merchandise, which is Target and Walmart and those, and then grocery. So those are the 4 focus channels.
Yep. And for where to buy, because I saw a few questions in here. So we have a store locator on our website, thefeelgoodlab.com. If you click on the shop, you can easily find the store locator. And there's, depending on where you are, I think somebody mentioned they were in Pennsylvania. So we actually have a handful of CVS's there and some Targets in the Pennsylvania area that might be really close to you. We're also sold on Target.com, Amazon.com, our website, and CVS.com.
CVS.com.
Yep. And so for people on here, I think the cheapest, fastest way to get it digitally is probably Amazon. And the fastest way to get it in store would be CVS or Target.
Perfect answer. And I love hearing a story about C-suite executives, boots on the ground, learning and adapting. So that was super cool to hear. Awesome. Well, a couple more questions coming in, and I'm going to hold on to at least a couple moments at the end. I'm giving you guys a heads up here. No one ever gets this heads up, but I'm old school. So I love a closing remarks section. So I'm going to end with why should somebody go directly to the site right now and invest? So I'm going to get those gears turning for a moment. And that's a preface that most of my panelists don't get. So I'm expecting some pretty exciting remarks there. But before we get to that point, is the product used once a day or several times per day? Still a good question.
It's that's a great question. I'm going to actually answer it a little bit more detailed. The way you use the way you use any product is sometimes as important as the product itself. And when it comes to a topical, we've learned this firsthand in my dad's pharmacy. If we do not prepare the skin properly and use it as directed, we're going to have no chance. One of the main things that we learned through the education of the Feel Good Lab is consumers aren't used to this. And so we have, when you buy the product, you'll notice we have a beautiful pamphlet that really clearly lays out, 1, my dad's credibility on why he knows the answer to this. And 2, we offer a guarantee. We offer a money back guarantee on our product. All we ask is you use it as directed. So depends on who you are. If you're an athlete and you're sore, we recommend 1 time a day out of the shower. If you are in chronic pain, severe arthritis, the FDA allows us to recommend it 4 times a day. But if I was talking to you personally, I would say you could even use it more than that. I mean, consistency of application, it's more important to use a little bit often than it is to use a lot one time when it comes to delivering through the skin. And it's because of the reservoir effect and the way that ingredients build up through the layers of the skin as they actively go through. It's a very long process. So we think of our product much more like a multivitamin than we do an instant pain reliever. At the same time, we need to be careful because we're approved as an instant pain reliever. So we're going to give you immediate relief. Right when you put it on, you're going to feel a little bit of a cooling sensation. The gate theory of pain means it's going to send the cold signals to your brain. It's going to block out the pain signals, and that's going to give you relief for about an hour. The consistent application is really what drives the ingredients in. So as well as a consistent application, there's a huge advantage to having clean skin, specifically when it's warm and a little bit damp. So right when you get out of the shower, if you put our product on your neck, I'm not kidding you, it's going to feel more than 10 times colder than if you just put it on without. You'll feel the absorption so much more. That's just the menthol you're feeling, but the other ingredients are absorbing deeper as well. So when you put it on is also critical to how much absorbs. So we recommend, if you can, when it's on your back, it's a little inconvenient, so you can apply the product without cleaning. But if it's on your hands or on your elbow or an area that you can get a damp washcloth on, just a little bit of moisture and heat really, really open up the skin. And the significance, like our product's only as good as the amount we're able to deliver through the skin. And those couple of tips can make all of the difference for customers.
That was a really good answer. I hadn't thought about all those things, but it makes a ton of sense. And I'm glad that people will be able to walk away with that information. And for those who watch this recorded later on, it looks like you've converted a couple of users and maybe some investors already on this call. So thank you for joining me. I think this is what this is all about, is better understanding the team and better understanding the company that the team is running. So I'm really happy to hear that. It looks like we've accomplished those goals. As mentioned, the moment here, the closing remarks, I'd like to end with Ryan here. So Kyle, why don't you kick us off? Why should somebody go directly to Feel Good Labs right now and invest in your company?
All right, I'll take that one. But first, I see somebody saying they were at Yukon during NCAA basketball championship in 2011. Michael, I was actually a walk-on for Yukon, so I was playing basketball there in 2006 and 2007.
That's awesome.
But we won a championship after I left, so what does that tell you? But anyways, I think your question was, why should somebody go to the Feel Good Lab, consider investing in us? The first thing I'll mention is that I think why people invest in anything, that there's potential for immense financial returns here. And if you look at the BioFreeze case study and you look at the channels that we're operating in, we have a realistic chance to capture that value in the next year, 2, 3, or 5 years. We really do. Aside from that, all I'll say is that, one of the reasons that we love building our own company and we love to do this every day is because we get to spend time with each other and we respect each other. We have all worked corporate jobs and we know what it's like to be in an environment that stifles creativity and, doesn't allow you to really capture the potential of what you could be working on. And we're a very transparent team. So this is an opportunity to be a part of our team and really join us on this journey that has the potential to not only make money, but help a ton of people. When you think about the products that people have been using to treat pain. I mean, I think about my dad and my parents who have been popping ibuprofen every day for 30 years, and which has led to so many side effects. And those days are ending. A pill for every ill. That was my parents' generation. The younger consumers are waking up to those side effects, and the brands have not provided the right products to fit that need. And we think we're that company. So I'll leave it at that.
Thanks, Guy.
That was great. Thanks, Ryan.
So obviously, you invest for financial gains, and to echo what Kyle said, we really believe in what we're building from the financial side. We think we have the team to do it. We think we have the strategy. Obviously, everybody knows with the strategy, there's ebbs and flows and you learn a lot of lessons, but we know that the market, the biggest thing to me is the market needs this so bad. If you look at the over-the-counter pain space, specifically treating chronic pain, there are no healthy options. And whether it's our current product, our CBD products, medical marijuana, the thing that we're passionate about, and I think everybody here is definitely picked up on my passion, that's the reason to invest, in my opinion. We are never going to stop. The ability to affect the chronic pain epidemic with healthier solutions, no matter what the products and solutions are, we're going to be pivoting as new things come out. That market is so underserved today. And what we've learned just over the past few years of doing it, we are making a huge difference. We get customers reaching out every day that we change their life. And so you have, as much as we all need to make the financial benefit, that's why you invest. We really believe in what we're doing and the ability to make a difference in the world too.
That's perfect. And we're right on time. I see people are heading out to the next things. Thank you so much, Kyle, Ryan, for joining me. I think it was incredibly informative. I'm pumped. I love the passion and the energy that you brought to this. So thank you so much. Thank you so much to our attendees and the engagement. The Q&A section was absolutely phenomenal. So please continue to send this. We'll have the recording up on YouTube. You can share this with others who couldn't make it. And as always, you can visit netcapital.com, search the Feel Good Lab, and invest. So as we're winding down here, thank you so much for everybody for attending. Happy holidays and have a very happy new year. And we'll talk again soon. Thank you so much.
Thanks so much, Eric. Great job, man.
Thanks, guys. Thanks, everybody.
Bye now.